Hey everyone, and welcome back to Open. I'm Rhina Valentin, your host of Cafe con Leche for the next hour, encouraging you to get social with us online. That is, tweet us at and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, follow me on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. So, systemic racism is America's biggest stain that has been killing Black and Brown people for many years now, some fueled by police brutality, but ultimately, it's a socioeconomic condition that continues to lead the health disparities amongst Black and Brown people. And in the past few months, we've witnessed the killings of George Floyd, Ahmaud Arbery, amid a pandemic that continues to disproportionately affect community of color. And joining us to discuss being on the front line, we welcome emergency registered nurse at Montefiore and New York State Nurses Association President Judy Sheridan-Gonzalez. Hi, Judy.
Oh, hi, how are you?
I'm good. First and foremost, I want to thank you for your service.
Yeah, you really have to thank the thousands of members across the state and particularly in the area of the epicenter of the pandemic who sacrificed so much. Uh, there's just been such trauma visited upon the staff who's been caring for these patients and in fact, deaths among our nurses as well.
You know, it was an honor meeting you on Sunday, watching you march on the front lines. As you saw, I opened up this segment addressing racism as a health crisis. Can you elaborate further on what it is that you've experienced throughout this pandemic, which I'm sure you're still dealing with, but now that I guess we could say we've already hit the curve and are coming down. What has that been like for you, and what have you noticed when it comes to our immediate community?
Well, you have to place it in the historical context of racism in healthcare and what we call the social determinants of health, which consist of racism, sexism, poverty, lack of education, lack of nutrition, lack of proper housing, lack of the ability to engage in exercise activities and leisure activities, and lack of space, particularly important during COVID. Our communities had the worst health indices in the Bronx. It's number 62 in the nation, in the state of New York, rather, in the counties of New York. And during COVID epidemic, it was the same statistics that we dealt with. The people who were most affected were people who had these comorbidities or conditions that rendered them less capable of surviving the virus. We saw it all the time. So we were inundated with this virus in the Bronx communities, in which certainly in the Bronx community that I live and work in, and in Corona, in the Far Rockaway, in all the areas where people of color live because of all these conditions. For example, when we talk about social distancing and we talk about quarantining at home, this is not a possibility in people who live in cramped apartments. I remember the first, when it was very, very early on into the virus, I had a grandma who had COVID and had a mild pneumonia. And at that point, we weren't even meeting people with mild pneumonias because we were just so inundated. And we were talking to her about how to isolate herself at home. She was a grandma. She lived with her daughter and six grandchildren in a one-bedroom apartment, and she did the cooking. So what was she supposed to do to isolate herself at home? There was no way in the world she could do it. We don't have backyards and front porches and all kinds of activities that people can engage in to stay healthy. So not only were people affected because of the comorbidities, but also because of the lack of facilities and ability to do the things that they needed to do to mitigate the virus. So the rates of infection were incredibly high, not only among the patients, but also among the workers in our facilities. And of course, the death rates were extraordinarily high, and the statistics all bear to show that very well.
And so, based on everything that you've experienced, and based on your knowledge, and based on your experience, because you've been at this for 30 years, um, what do you think could have happened to make this more efficient?
Well, I mean, there's the long-term solution, which is to change the way healthcare is delivered. As an organization, we support healthcare for all, a single-payer system in the state and in the nation, where healthcare is not built around making profit, but around providing care equitably. And I'm talking about access, I'm talking about quality, I'm talking about all the supports that people need to stay healthy. But for the moment, and we're seeing a repeat of this, which is really frightening. the hospitals refused to work with the unions, particularly our union, in talking about how to plan for the pandemic. We met with them early on in February and said, listen, we've got to prepare for this. We don't know what's going to happen. We have to get the equipment. We have to get the PPE, the protective equipment. We have to get the staff. We have to get the beds. We have to get all these things. And they refused to work with us. And then we were completely inundated with such unsafe situations and unsafe conditions that people have PTSD from caring for patients they couldn't possibly take care of. And that certainly resulted in very bad outcomes. Now, as we look forward, even though the news is quiet, we look forward, perhaps, I don't mean look forward in a good way, in a bad
Right.
way, to a potential surge. Same thing's happening. They're not prepared again. We're saying, let's meet, let's talk, let's figure this out, let's prepare. Uh, again, they're just looking at how to make a dollar, how to make a profit.
So where are we now in this whole, I guess, attempt to reform healthcare as well? Because basically, what you're saying is that um, there's really no change, and there hasn't been change, and from what we observed, right? Because we're being informed through news and media and so forth. You guys weren't equipped to even handle something like this, which puts everybody in a really bad position. And being the president of the New York State Nurses Association, how are you guys advocating to make sure that something like this never occurs again?
Well, we did promote certain legislation that passed, some did not. I think one of the big issues for us also is getting additional revenue. The way taxes are paid in this state and in this nation are outrageous. In New York, we have such disparities in economics. The very super wealthy pay little or nothing in taxes, and there are many initiatives, many legislative proposals that have been put forward, but just don't get any attention. We don't want to fight with education advocates and healthcare advocates and housing advocates over crumbs. We need to make that pie bigger, and that pie can be made bigger by taxing the rich through the pied-à-terre tax, stock transfer tax, things that are actually virtual, won't even touch them, but can finance and fund our communities and deal with the issues, the incredibly challenging issues they face. We have three crises in the nation right now: the corona crisis, the economic crisis, and this has always been a crisis, but is now in the forefront, the crisis about racism in our nation and how it affects people from womb to tomb, from pregnancy to death, post death, it's overwhelming and it has to be dealt with.
And so, just to share with our viewers, I met you on the front lines at Sunday's protest with the Latinx community protesting against Black Lives Matter, and you were there on behalf of the Nurses Association. And you also shared with me that this is kind of reminiscent of an experience that you had, what, like 20 years ago, and we're still in the same place?
It was 50 years ago,
50, okay,
older
I
than
was thinking,
that.
I was trying to
uh,
be fun.
it was reminiscent of the movement in the 60s where a lot of this stuff sort of came out. It was a big awakening for America, where people were demanding changes. We did get some changes, but unfortunately, fundamentally and substantive changes have not occurred. Uh, Maybe some is window dressing, some is real, but in fact, people of color still suffer incredible discrimination, high injury rates, high death rates on every count. And I think that it's very exciting to see a new generation, much more sophisticated in many ways than I think we were when we were young,
Right.
because of the ability to learn about the world. Uh, out there leading this struggle. It's really exciting. The struggle for racial equity, racial for equality, the struggle for climate justice, for environmental justice, for economic justice. I just don't want it to die out. I think we have to really support our young people and support the things that we have to do to make this a better world.
I know it was lovely to share that space with such an interracial and intergenerational community, being educated along the way. It was a wonderful tour. And in closing, I want to just please share your words of wisdom on how to move these policies forward, this legislation forward. Like, we need people to vote. We need the census filled out. I mean, please share whatever it is that you feel is going to galvanize the next generation into coming together but making a difference.
Well, I mean, when it comes to voting, I mean, we support the candidates. We're very much involved in Jamal Bowman's campaign. Uh, as for Congress for the area in which our hospitals are. AOC, all these progressive legislators who are putting forward healthcare for all, a better educational system, supporting public education, not having, have the highest incarceration rate in our nation,
Right.
and also safe staffing in our hospitals, that the hospitals in poor communities should have the same conditions as the hospitals in wealthy communities. At least in healthcare, can't we begin there to have some equity where our patients are treated the same, where they are subject to the best healthcare possible, the best staffing, the best environmental conditions? That's what we're fighting for, and to protect. We have an oath. We all took an oath. It's called the Florence Nightingale Oath, to treat all people the same, regardless of any other factors, whether they have papers or not, whether they're immigrants or not, whether they're documented or not, what they look like, what their income level is. That should be something that should be embraced by all of our society. It happens with voting, it happens with legislation, but I don't think any of this happens without mass mobilization of people. And we've seen that in the last 2 weeks.
Beautiful. Thank you. And thank you for sharing that with our viewers. You guys, once again, that was Judy Sheridan-Gonzalez advocating health care for all. She is the president of the New York State Nurses Association. And if you want more information, you can also visit nysna.org. All right, we have to take a quick break, but when we return, we'll hear about a march for the LGBT community and Black lives. Don't go anywhere.